Good morning, President Small and City Council and Chief of Staff Barber. Nice to see you guys this morning. We're here with AltaPointe this morning, and we really just wanted to come by and give some periodic updates on some of the special things that are going on with our organization. And today, and I think you remember back about a year and a half ago or so, we opened up a new crisis center for Mobile and the surrounding areas. And we just wanted to give you a little bit of an update. And I think Dr. Cindy Gipson is going to be here to help us with those updates. But before we do so, you know, the updates are going to be very interesting. But I really did want to use this opportunity to continue to educate the council and the mayor's staff and the public that are watching about what this crisis center is. So many days go where I get a phone call or somebody who's been in a mental health crisis, either their family members or themselves, and they said, you know, I'm in this mental health crisis and I didn't know where to go. I didn't know, where I could just go and get immediate care. And that's what this was put in place for. It was put in place for our citizens to be able to go, like these new freestanding emergency departments that are popping up everywhere. The crisis center is like a freestanding emergency department for psychiatry, for mental health and substance use problems. It is just like an emergency room for that. So I wanted to give you that update and let everybody know that it's open 24/7. You can walk in. We have psychiatrists around the clock who are there to treat you and to help stabilize you and get you right back on your feet. And now I'm going to turn the podium over to Dr. Gipson to give you a little bit of an update on our crisis statistics that we've got over the last little while. I think we've had over 3,600 patients who've come through the crisis center so far.
Hey, Tuerk, before you turn it over, where is the location of the crisis center?
It is right at the corner of Stanton Road and Gordon Smith Drive. It's right by University Hospital.
Good morning, Dr. Cindy Gipson for AltaPointe. Thank you for allowing us to be here today. And it is a privilege to have the Crisis Center here in Mobile. And as Tuerk said, we've served over 3,600 individuals since we've opened. Those are 3,600 people who voluntarily sought treatment. And the purpose of the Crisis Center is to provide that place that's been missing for someone to go when they're in a psychiatric or substance use crisis. 60% of the people we serve have a substance use disorder or co-occurring substance use and mental health disorder. And we're able to help get them back out on the street and into their home with the support they need, getting treatment rapidly. And the Crisis Center has been a diversion from our emergency departments, from arrest. Over 1,000 people have been brought by law enforcement officers instead of being arrested. And that is a huge difference in our community. And it has helped increase our collaboration with Mobile PD in particular and law enforcement in general. But we are doing a lot of really neat things and progressive things with law enforcement that is part of that crisis continuum of care. And the savings to our community have been exponential, over $35 million since we've been open, in diversions to emergency rooms, the jail, psychiatric hospitals, the probate process, and ambulance transports and such. So the Crisis Center is available 24/7 for anyone in need. And like Tuerk said, it's in the Tolmanville community. And we are really pleased with the outcome and with the support the community has given us and the support that the council has given us.
Can you talk a little bit about the detox that's
Yes. We have had so much substance use disorder issues that we are opening a second
council. It's okay for them to keep going. Good, keep going.
Thank you. We're opening a second unit that is dedicated to substance use only. It's a 6-bed detox facility. There is no place in our region where someone can detox without worry of cost to themselves. And 70% of the people we serve are uninsured and have no way to pay. The detox facility allows us to use our psych beds for psychiatric stabilization, which has been an issue. The substance use tends to crowd that out, but that will be opening this month and provide an alternative for the high rate of substance abuse we've seen, particularly since COVID.
Mr. President,
Mr. Reynolds.
where will that substance abuse detox facility be located?
It's in the crisis center.
Okay.
Mr. President.
Vice President, then Mr. Carroll, and then I think it was Mr. Davis. Okay, Mr. Carroll.
Appreciate you coming down today and sharing this news with us on the crisis center. Is that strictly a walk-in, or I've noticed a lot of these are saying diversion? So are people going to the hospital and then being sent to the crisis center, or how is that working?
Sometimes, preferably, they are coming in themselves. Family brings them. If law enforcement gets involved, they will bring them. And sometimes we get them after they've been to the ER. We're working with the City of Mobile's EMS department right now for direct transport to the crisis center. But our goal is, to get them where they can get immediate treatment. You go to an emergency department, and if it has 6 psych patients in it, you're not going to get the care you need if you're having a heart attack. And so, and the psych patients are not getting the care they need because they don't staff a psychiatrist. So we want to get people to the right place when they need it.
Good, thank you.
Thank you.
About a year and a half ago or so, we had some continuing conversations about mental health and people on the actual street. There was a program that was being implemented with the Mobile Police Department. I'd like to know what type of successes or failures we've been having with that program.
Absolutely. That is one of my proudest things. And Commander Graves, I always say he's my partner in crime. He can speak to that as well. We work closely together in a collaboration with AltaPointe's clinicians and Mobile PD's officers, where we have offered them training. We have stepped that up to include virtual reality training. We can recreate any scenario that has happened here in Mobile and let officers go through that scenario and change the course of the outcome and learn from their mistakes, or learn new tactics, de-escalation skills, particularly for dealing with individuals with mental illness, substance use disorder, neurocognitive disorder, intellectual disabilities, and such. And then we also co-respond with law enforcement. I go out with the SWAT team occasionally. We respond anytime there's a mental health call that the officer requests us on scene. We're on the same radio dispatches as law enforcement. And our latest venture, we have iPads in officers' cars where they can connect directly to a clinician to do an evaluation with the individual in the field, and we can get them the help they need. Sometimes those folks are completely unknown to us. We have 30 iPads right now, and are continuing to roll those out through a grant from the Bureau of Justice Assistance.
Are there any noted successes where we've de-escalated a situation where the consequence or the outcome could have been totally different?
Absolutely. I think one of the most memorable successes has been an instance where we were out with SWAT, and we arrived on scene shortly after they did, and were able to give them some background information that helped them make a decision that saved a life. And there are numerous instances of saving someone from going to jail and getting them into treatment when they need it. And those are certainly, helpful diversions for both the county and the city.
Yeah, on the life, I would be interested to know what that date was, when that actually happened. You don't have to tell me who or what. I'm interested on a date.
Okay, I can tell you.
Yeah.
Not off the top of my head, but
Just if you would, just I just want to use it as a benchmark before or after.
absolutely.
Anyone else?
Mr. President.
Mr. Penn.
Thank you, Mr. President. Again, I want to thank y'all for coming down. Thank you for your service. I had the opportunity. I actually saw the work at hand when a situation when I was working with a young person, and we had a call, and the team came out and assisted in that situation. So I definitely seen the service that was provided, and it was a great service. So thank you so much.
Yeah.
I had a question with the detox. Now, how if a person wanted to be a part of that program, how does that work? But like
They can walk right in.
they can walk right in. If a family member wanted to, they have to agree to be a part, of course, right?
Correct.
Okay. So is it a number that they can get in contact, and if they wanted, more information?
Absolutely. Our access to care number is 450-2211, and that's staffed 24/7, and they can provide any information and guidance. And our crisis team often goes out and tries to convince people who are struggling with the decision to come on in and get the help they need.
Okay. Now, do you all provide like maybe like talking about like I guess a seminar, like if the community wanted to bring and do a session?
Yes,
Yeah.
that's something that Commander Graves and I have talked about with the virtual reality equipment, is setting up times when community members can come in and use that equipment and see what it's like to de-escalate someone in a mental health crisis, and what that looks like from the law enforcement perspective, as well as what it looks like from the perspective of the individual in crisis.
I would love to be a part, and
We would love to have you.
and set that up with some community engagement in our community.
That would be excellent.
If we can do some dates, I would love to set something like that up soon. Thank you.
Anyone else? Thank you all so much.